COVID-19 or the coronavirus is a worldwide pandemic. It has a huge impact everywhere in the world. So I wanted to do some analysis to understand how significant this problem is and what might happen in the future. I created a notebook in Google Colab to plot out some of this data and to understand where things are going. And I'll provide a link to this notebook. You can open it, you can work with it, and you can do some more analysis on your own to get some understanding of what's really going on. So there are some publicly available data sources. I happen to use Our World in Data. And if we look at this data source here, Our World in Data, it provides data from the European Center for Disease Prevention and Control. So on a regular basis, they update this data set and they give us the number of cases per day. And in fact, they give us 4 different data sets: the total number of confirmed cases, the total deaths, new confirmed cases, and new deaths. There are also some other visualizations that are available on this page, but I wanted to do my own analysis to get a better understanding of what's going on. So to do this analysis, I'm going to use several libraries. I'll use Pandas because this is comma-separated data. I'll use Matplotlib for plotting and NumPy for analysis. So I'm going to load the data here, and I'm going to load all 4 data sets like this. And also, there's one detail. There happens to be a particular spike on one day in China that kind of skews the data. I don't know if that's actually accurate. So this little bit of code right here was just to remove that one spike in one day. And it's earlier in the year, so I don't think it really matters all that much. And then I'm going to just look at the total cases, just the current total cases, the last 5 of them. And so the way the data set is organized, it has a date by each day, and it has regions, like, let's say the world, and this is the total cases for the world. On 3/22, there's 305,000 that are known, that are reported, and then we have different numbers for each region or each country. So first, let's look at what the hardest hit region is. So if we look at the number of deaths, that's an indication of who has the worst situation right now. So this gets the maximum value of all the last day on 3/22, and what this says is Italy is has the largest number of recent deaths, totaling 795 on 3/22 alone, a huge number. So that's just in one day. So I have a number of other cells where I'm going to do some analysis based on different regions. And you can choose regions that are of interest to you. I'm going to choose China, Italy, South Korea, and United States for a number of different reasons, because you'll see different countries that have already had early impact and what they've done, and other countries that are dealing with it right now. So I'm going to just select those 4 regions. And what I'm going to do is look at the new cases by date. The new cases by date. You notice China, they had the earliest cases because it originated in China and it grew very significantly. But eventually they appear to have gotten it under control. There is a spike here, and I'm not really sure why that is. That could be a reporting error. I'm not sure. But eventually they did get it under control, and it seems to be almost at a manageable level now. And similarly, South Korea, they also had a growth rate, but as we know, South Korea had a very aggressive testing plan and social distancing in place, so they were able to get things under control relatively quickly, and now it's quite manageable. So it's something they can work through. Italy, on the other hand, is not in good shape at all. You see this exponential growth. There are a couple of spots where maybe there was some incorrect reporting, but just huge growth, and it doesn't seem to be slowing down. Similarly, the United States, there were some measures put in place early, so there weren't very many cases, but once they started, and also there wasn't a lot of testing that was going on in the U.S. for quite a while, so in many cases we may not even have known what was going on. But you know now, when there's more testing going on, the number of cases is quite significant. It is really growing significantly. So on a daily basis, there's thousands, maybe 10,000, and eventually probably get to 10,000 not too long, per day. So if we look at the number of deaths by date, you see that China had the highest number for quite a while, but eventually they got it under control. And South Korea also had some deaths, but it's not too bad. The U.S. has some growth in the death rate, but still it's not a very large number compared to the total population, maybe 100 or so per day. But if you look at Italy, it's really alarming, extremely alarming. You see this incredible growth rate, and it does not appear to be slowing down. So as we saw, yesterday was 795 deaths, and it does not seem to be slowing down at all. So why does this happen? Well, this is based on something called the basic reproductive number, and this is a number that epidemiologists use to understand how quickly a particular disease grows or how it multiplies in the population. And each disease has different rates, and these are some numbers that I was able to find through my own research. That what has been published is that COVID-19 has a reproductive number of 2.9, meaning that every person will transmit the disease to roughly 3 people or 2.9 people. In comparison, the seasonal flu, the reproductive number is 1.5, and polio is 6. So there's a wide range there. So COVID-19 appears to be in the middle of these two. There's some variation, and that depends on a lot of factors: social distancing, how many people you interact with, and so on. So we have the ability to control this depending on what we do. But this just shows that in general, based on normal interaction, the COVID-19 it reproduces much more quickly than the flu. So that's one of the reasons it is a problem. So we can estimate how quickly this disease is growing right now. And we can estimate that based on how quickly it has grown in the past few days. This equation computes what's called the doubling rate, how many days it takes for the number of cases to double. And the way I calculated it, assuming this is exponential growth, the number of days to look back, and the number of cases during those number of days. So if I go through this calculation, I can do it for different regions. We have the data for different regions, and I'm just going to look back one day, just based on one day. That may not be the most accurate way to do it. We could look at several days and average over several days, but I'm just going to look back just one day, what the rate is. So if I do that calculation, you see the doubling rate for different regions or different countries here. And you see Italy has a doubling rate of a little over 5 days. So that means every 5 days or so, the number of cases will double. Number of reported cases will double. In the case of the United States, it's about 2.2. So it doesn't take long for things to double in the United States. Germany is a little bit better. The number is about 4 days. And this is a change from yesterday. Yesterday, I noticed that Germany had a doubling rate that was a little bit more than the U.S., but now they seem to have gotten it maybe a little bit. There may be some improvement in Germany. And France is also around 5. So you can see just from these 4 regions, the fastest growing region is the United States, which means that it's doubling every 2.2 days. So every couple of days, we will see twice as many cases if nothing changes, assuming that the growth rate remains what it is. So given that doubling rate, we can make some projections on known infections. This is based on known infections. So that equation looks like this. So the number of cases that we will see is the current number of cases that we know about today times 2 to the number of days divided by the doubling period, or the number of days it'll take to double. So if I run this, and I'm going to look forward 7 days, just 1 week. And these are the projections, given our known doubling rates. So you see Italy, it has a modest growth curve like this. Right now, there are something less than 60,000 cases. This is thousands of people, so there are a little bit less than 60,000 people. The US has much fewer right now. It's maybe 24,000 or so. But you notice that since the US has a much higher doubling rate, in just a matter of days, 3 or 4 days, the US will surpass Italy with the number of cases, assuming nothing changes. And you notice that the growth rate grows very quickly. So this is all just the number of reported cases, the ones that have been fully tested. And some of this growth could be due to the fact that there's just more testing going on in the US. It could be just due to the amount of social distancing. A lot of the social distancing controls were just put in place in the last week or so. The schools have only been closed in the last week or so. So we may not see the effect of all that social distancing for a little bit of time. So this may just reflect those factors. Hopefully that's what the case is. Because you can imagine if this is the true number, that it's doubling every 2.2 days, things get out of control very, very quickly. But the actual number of infections is actually probably much higher than the number of known infections. And the reason for that is there's some lag time. So one of the really challenging problems with COVID-19, as many of you know, is that you may already be infected, and you may not even know it, but still you're shedding virus and you're infecting others. Your symptoms may be very mild, and you may go through and not even know that you have coronavirus. But during that time, you're infecting other people. And the people that actually get to the point where they're actually tested, there's some time between infection and the actual test. So there's some lag time. So I call this number L the lag time. So to estimate the number of people that are actually infected, which is significantly higher than the people that have actually been tested, and we know positively they have coronavirus, it means that we have to shift our calculation forward a few days. So it's as if what we see now is a lag in time. So it's the same equation we used above, but we use the current number of days and then we'll add some lag estimate. And in this case, I'm just going to assume that the lag is 5 days. That's just a number I came up with. So that let's say that it takes 5 days for you to show symptoms and to actually get tested and so on. It may be more, it may be less. You can change this number and get an idea of what really happens. So if we run that and assume a lag of 5 days, even though the U.S. has a number of around 24,000 reported cases today, the actual number of people that probably have it is closer to 100,000 or more, over 100,000. And you notice Italy has about 100,000 possibly right now. And you can also see this growth rate. So given the current doubling rate, in a week's time, the U.S. will be getting close to 1 million cases. And if it stays at a doubling rate of 2.2, maybe in 10 days or so, there may be 1 million people in the U.S. that actually have coronavirus, many of which probably don't even know that they have it. And in a few days after that, we may be up to 3 million cases, which is about 1% of the U.S. population. So I'm hoping that a lot of this growth rate is based on just recent testing and the growth in testing, and it's not really doubling as quickly as the data shows right now. And I'm hoping that a lot of the social distancing measures that have been put in place, all the schools are closed, there are a lot of businesses are closed, many people are working from home. Hopefully this will reduce this growth rate. And you can watch this every day and look at this number. So you can look at this number, the doubling rate, and try and determine if it is getting better. So hopefully if this doubling rate goes down to maybe a week or a month, that would be pretty good because that buys us a lot of time. What this shows is how important it is for us to control the infection rate or this doubling rate. And we can do this through a number of methods that have been well documented, like social distancing, washing your hands, and so on. Just good practices. And given that they say that it takes about 2 weeks for coronavirus to run its course, if we spend about a month and there's enough social distancing and we don't have new infections for a month, then it will probably go down as quickly as it goes up. But that really requires that everyone follow these strict procedures. But if we don't, you can see things can get very bad very, very quickly. And at some point, it's going to outstrip our medical resources, because some significant percentage of the population is going to need intensive care and a ventilator. And it won't take long for us to outstrip that capability, and things become very, very difficult. So this is some simple estimates that I've made based on some assumptions and widely available data. So you can look at this notebook, look at the numbers yourself, look at the calculations, adjust the numbers, look at different regions, and try and get an understanding of how important this case is, because I think this is going to affect all of us throughout the world.